You know, while we continue to track Hurricane Ida and the weather continues to be today's top story, it's a serious one, and we know our health is serious too.
Yeah, so we want to talk about something that I recently sat down with the director of Allegheny Health Network's Men's Health Center to have a conversation about several key issues for men, and they are topics that men probably would like to avoid.
It's a discussion that could be awkward or uncomfortable, but could also be life-saving.
In today's Eye on Health, we're talking about men's health. And in fact, sometimes men are reluctant to go to get medical help. But September happens to be Prostate Cancer Awareness Month. So I am joined right now by Dr. Herman Bagga. He is director of the Center for Men's Health at Allegheny Health Network. And we want to talk about really a couple different issues. But first, let's talk about prostate health. And how often should men get a prostate exam?
So the prostate, just so everyone knows, is a small gland that's present in men, not women, just in men. It's responsible for reproduction. It plays a role in that. But as men get older, the prostate can change in size and in shape, and it can cause some issues that are seemingly unrelated. One of those are urinary issues. So men might complain about difficulty going to the bathroom, difficulty urinating, getting up a lot at night, not getting a proper night's sleep as a result. That's because that prostate's getting larger and making it difficult for the urine to pass. So that's one major issue that we deal with. The other is prostate cancer. You know, prostate cancer is always on the forefront of everyone's mind because it's the second most common cancer for men in the United States. Over 250,000 cases diagnosed per year.
So is that something that, if you're not having symptoms, do you need to worry about that? Or at a certain age, should your primary care physician be taking a look at some things?
So it's very important to know. Even if you're not having symptoms, it's important to screen. The good thing about prostate cancer, no, there's never a good thing about cancer, of course, but the good thing is that when properly screened, it can be caught quite early and is very treatable. For most men around age 55 or so, we start doing screening, which is a physical exam, a good history, and a blood test known as a PSA test. Some men who maybe have a higher risk, maybe a strong family history, a genetic predisposition, will do a little bit sooner, but in general, around age 55, either your primary care doctor or your urologist, you should start getting screened.
All right, one of the other things that you said is important to talk about is erectile dysfunction, because that in and of itself can be a symptom of prostate problems or really a symptom of a bunch of other health problems, right?
Absolutely, and that's very important. You know, at the Center for Men's Health, that's one of the major things that we deal with quite often. Men come in with a concern for erectile dysfunction. Erectile dysfunction is very important because it doesn't just affect the man directly, but it can be a peek or a glimpse into their overall health. Certain chronic medical conditions can be causing the erectile dysfunction. And one that's very notable is the association between heart disease and erectile dysfunction. My patients are always very surprised, but there's a very strong correlation between the two.
Well, let's talk about testosterone levels too, because that's something that is very important, and people might be surprised how big of an effect it can have if your testosterone isn't correct, the level.
Absolutely. So testosterone is the primary male hormone. It's responsible for so many things in the male body. It's responsible for mood, emotional states. It's also responsible for body composition, so bone density, muscle location, fat distribution, sexual function, of course, like sexual drive or libido with erectile function. Also responsible for other things like development of red blood cells, and also drives sperm formation. So it's very important for men. Testosterone naturally goes up during a lifespan, and around age 30 to 35 it peaks. Then it goes down 1% per year. For men where that decline is maybe a little bit too fast or ends up a little bit too low, you can end up having issues. And my patients will complain about being fatigued or tired. Maybe they're not having good sexual function anymore, they're having memory issues, not sleeping well. You kind of get this constellation of symptoms that they'll talk about, maybe muscle despite trying to work out and eating right. So we kind of look into ways where we can test for that level and potentially supplement if necessary.
Doctor, thank you for talking with us.
Yeah, you got it.
And really highlighting some important things for men's health. We appreciate it very much.
Thanks for highlighting Men's Health Month.
Really such an important conversation to have. And remember to keep watching for our Eye on Health series right here on PTL.
Yeah, it happens on Wednesdays, and it's sponsored by Highmark Blue Cross Blue Shield together with Allegheny Health Network for your health.